Hello guys, welcome back. This is the second part of ICD 10CM Update 2026. So I hope you already watched first video. So this video is important for coding and for interviews too. So we will start where we left. Chapter 6. In Chapter 6, there is an important update related to multiple sclerosis. The old code G35, which was used for multiple sclerosis, has been deleted. Instead of one general code, new, more specific codes have been added. So, what is multiple sclerosis or MS? Multiple sclerosis is a long-term autoimmune disease. In this condition, the body's immune system mistakenly attacks the brain, spinal cord, and optic nerves. This attack damages myelin, the protective covering around nerve fibers. When myelin is damaged, nerve signals slow down or get blocked. So the new ICD code is now divided into primary multiple sclerosis and secondary multiple sclerosis. So these are the new code added from Chapter 6. Chapter 7. In Chapter 7, several new eyelid inflammation codes were added to specify the exact location, which was not possible with the previous codes. So the code is from H01.81 to H01.81B. Next update is the condition called thyroid orbitopathy. New codes are added for thyroid orbitopathy. So thyroid orbitopathy is an autoimmune condition that affects the eyes and the tissues around the eyes. In simple words, it happens when the immune system mistakenly attacks the muscles and fat behind the eyes. This usually occurs in people with thyroid disease, especially Graves' disease. The second new added code is for glaucoma. Now moving on to secondary angle closure glaucoma. This is a type of glaucoma where eye pressure increases because the drainage angle of the eye becomes blocked due to another underlying eye or systemic condition. So in neovascular secondary angle closure glaucoma, this blockage is caused by the growth of abnormal new blood vessels inside the eye. Chapter 8. So in Chapter 8, there is no any new update. Chapter 9. In Chapter 9, 4 new codes related to Fontan-associated disease have been added. So first, let's understand, what is Fontan disease? As we know, the human heart normally has 2 ventricles. The ventricles are the lower chambers of the heart, and their main job is to pump blood out of the heart. The right ventricle pumps deoxygenated or impure blood to the lungs. The left ventricle pumps oxygenated or pure blood to the entire body. Now, Fontan disease, also known as Fontan physiology or Fontan circulation, is a condition seen in people who are born with single ventricle congenital heart defects. In these patients, only one functional ventricle is present instead of 2. In our upcoming lectures, we will be adding an anatomy series specifically for medical coders. So if you would like to get that video early, please mention in the comments Anatomy for Medical Coders. Chapter 10 and 11. So in Chapter 10 and 11, there is no any new update. Chapter 12. In this chapter, some existing codes have been revised, and these revisions will now be applicable to the flank. In addition to that, new codes for furuncle of the flank and cellulitis of the flank have been added. So these are the key updates covered in this chapter. Now, there is the addition of 112 codes for non-pressure chronic ulcer based on severity of ulcer and location. So out of 487 new codes, 112 codes belong to non-chronic ulcer. So I hope you are aware of ulcer type. in non-pressure ulcer is a skin wound that happens because of poor circulation or disease, not because of pressure on the skin. So as we know that for any ulcer code, the ulcer code is divided as per severity. So these are severity. Severity such as with fat layer exposed, bone exposed, muscle exposed, and others. So for the new added codes are for non-pressure chronic ulcer of abdomen, neck, chest, face, and other new location. Chapter 13. So for Chapter 13, one new code is added for rheumatoid factor and other 3 code is revised. These are the codes. I'm not explaining every topic as it will take too much time, so I'm explaining what is important. Chapter 14. In Chapter 14, a new code has been added for acute nephritic syndrome with different types of membranoproliferative glomerulonephritis. In this code, you may notice the term idiopathic. So what does idiopathic mean? In medical terms, idiopathic means that the cause of the disease is unknown. You will see this term used in many ICD 10-CM codes, such as idiopathic neuropathy. So when a condition is labeled idiopathic, it simply means that no specific cause has been identified. Chapter 15. There is no any new update. Chapter 16. In Chapter 16, one code description is revised, P09.6. So the code description is changed from abnormal finding on neonatal screening for neonatal hearing loss to abnormal finding on neonatal screening. Now, moving on to Chapter 17. In this chapter, new codes have been added for Howe Fountain syndrome and CTNNB1 syndrome. The next code is Kabuki syndrome. Kabuki syndrome is a rare genetic disorder that affects growth, development, and multiple body systems. So why is it called Kabuki syndrome? The name comes from its distinctive facial features, which resemble the makeup used in traditional Japanese kabuki theater. This is why it is referred to as kabuki makeup. The next important update is related to Usher syndrome. Usher syndrome is a genetic disorder that causes both hearing loss and vision loss. The types, type 1, type 2, and type 3, vary based on the severity and progression of hearing and vision loss. Another update is related to neurodevelopmental disorders. In total, 5 new codes have been added in this category. In Chapter 18, the code R10.2 for pelvic pain has been deleted. In its place, more specific codes have been added to better describe pelvic pain. These new codes specify pelvic and perineal pain, including whether the pain is on the right side, left side, or both sides. The next update is related to flank tenderness and flank pain. New codes have been added to indicate the specific side, such as right or left. There are additional updates as well. For costovertebral tenderness, a new code has been introduced. So these are all the important updates from Chapter 18. Chapter 19. In Chapter 19, several new codes are added for contusion of abdominal wall, contusion of groin, blister non-thermal of flank, superficial injury and bites of flank. So this chapter is not as much important for interview. Chapter 21. So in Chapter 21, new codes are added for genetic susceptibility. Genetic susceptibility simply means that a person is born with certain genes that make them more likely to develop a particular disease or condition. In simple words, it does not mean the person will definitely get the disease. It just means their risk is higher because of their genes. So below are the new added code for genetic susceptibility. The next update is from prophylaxis. So prophylaxis means taking preventive measures to stop a disease or condition before it happens. So these are all important updates for ICD 10-CM 2026. Okay guys, how was the video? So did you like our series of ICD update? We will soon add some important interview question for ICD. Please mention in comment what type of videos you want. Thank you.